Good morning, everyone. Bob Ravenscroft, Vice President for Advancement, here for our September 24th media briefing. We have with us today, as promised, Kevin Hejtmanek. He is one of our practice managers in the Bryan Physician Network. Great Nebraska Czech name there, Kevin. He grew up in North Platte, attended Nebraska Wesleyan University here in Lincoln and got his BS in sports medicine. Then went on to Des Moines University in Des Moines and got his doctorate in physical therapy and then his master's in healthcare administration. Practiced physical therapy for about 13 years, and then we're just really fortunate to have him here leading one of our physician practices. He's going to share some information on other treatment and testing protocols in place now to make sure those that are even COVID negative are getting the needed care that they want, not just being sent home because they're COVID negative. So I look forward to hearing Kevin's report. With our number, and we did have one advanced question. I will cover that after Kevin's remarks, but I'll come back to that. So our numbers, we had 507 patients in here at midnight. We have now administered 23,878 tests with 2,726 positives. We do have 163 pending. That's really buoyed by the drive-through yesterday. It was a big day there. I think it was 117 that were tested there at the drive-through. And then we have, it looks like, some pending ones from our urgent care testing yesterday as well. As far as COVID inpatients in Bryan Medical Center right now, it now is 42 patients. 23 of them are from Lancaster County. 19 of them are from outside Lancaster County. There's one additional patient in-house that we're just waiting the result on that. So I guess we got total in-house positive pending at 43 for Bryan. And that was also a Lancaster County resident that we're pending that result on. There are 6 patients currently on vents. 4 of them are from Lancaster County. Of those, 10 are in the ICU, 5 in progressive care, and 27 in general care.
As mentioned, my name is Kevin Hejtmanek. I'm the practice manager for Bryan Urgent Care here in Lincoln. We made some changes with our practice patterns over the last few weeks, and I just want to pass on a few things that we've made changes to. In the past, we were kind of sending everybody to Bryan Urgent Care for any type of testing. Asymptomatic, symptomatic, and we wanted to be more direct with our patients. One is that symptomatic patients were coming to the facility and being tested only. We understand that there's still symptoms out there and illnesses that were there prior to COVID. So with that, we wanted to make sure we were establishing guidance for those patients, getting them evaluated by the provider, and also being COVID tested. So some of the things we are doing is making sure people that are showing up are symptomatic at our locations and being seen not only for COVID-19, but also for other conditions such as strep or influenza. Now, when we say symptomatic, those conditions can vary. We know we've heard in the past that symptoms are mild to moderate, 2 to 14 days. That's still the case. As we go to the next slide coming up, when someone arrives at the facility, we have a new change in our protocol. One is when you arrive, you will call from your car, and this is for all 3 locations. We encourage you to see a medical provider, whether that's your own medical provider prior to coming to urgent care or at our urgent care facilities. If you've seen your medical provider and your medical provider has determined there's no other cause for your illness and or they would still like you to get a COVID test, we will honor that medical provider's order and we will do COVID testing at our urgent care. If, however, you have not seen your medical provider yet in person for an assessment, we will still perform COVID-19 testing in your car, but also have you come in to see one of our urgent care providers again to rule out any other possible issues for your illnesses. Now, safety measures are important, and we put a few things in place to make sure that we are protecting not only ourselves, but the patients coming in the door. When you arrive at the facility and you call, testing will be done in your car. Staff will come out to your car. You'll be directed to the proper location in the facility parking lot, and they'll be wearing proper PPE to protect themselves during the testing process. Once testing has been administered per the provider's guidance, you'll be brought into the facility where you'll be seen by a provider. Following your visit, you'll be given instructions on what steps you'll need to do. Some of the results, such as strep and influenza, should be completed by the time your visit is done. So you'll have those results. Typical COVID testing does take 3 to 4 days. Once you're done, we'll walk you out of the facility and give you guidance on what needs to be done next, as well as go back into the room and perform proper cleaning measures to reduce the exposure to our patients. In our next slide, we'll be showing you that this can be done at all 3 of our Bryan Urgent Care locations. We have our current location that's been open for a few years at Life Point on South 27th. We have 2 new locations, one at our North Point location on North 27th, and our newly opened Southeast location on 84th and Pioneer. No appointment is needed. We will see you when you come. Show up. We're open 8 to 8 daily, and that's where we perform the testing and/or patient care. Again, typical turnaround time for COVID-19 testing is 3 to 4 days. Now, we also understand that people are exposed, and a complex component of COVID-19 is asymptomatic patients. We also want to make sure they have direction on where they can be tested if they've been exposed and would like to be tested. We encourage anybody with asymptomatic symptoms and/or exposure to call our Bryan drive-thru to schedule an appointment. They'll speak to scheduling, and they will set them up with a time on where they can be tested and where to be located. You can also visit Test Nebraska website, and they will provide guidance on where you can be tested. Certain essential workers, we do want to make sure that they are being tested timely. Those will be our Lincoln Fire and Rescue Services, Lincoln Police Department, the Nebraska State Patrol, and the Lancaster County Sheriff, all first responders. Please call the Bryan scheduling number. They will direct you to urgent care for rapid testing. Again, those are for our first responders. We want to make sure they're being tested as well. We have pre-ordered our flu vaccines for the locations, and so we do have some in-house. That being said, flu vaccines are a little more tight this year, and from our vendor, we've been instructed that if we are in need of flu vaccinations, that we get on an order list, which we are. So, as Bob mentioned, we do have some, not exactly tight, but it may be more tight and more difficult than the previous years. Again, the important message is that you are getting your flu shot, and that can be done at any location. We just encourage you to have it done by October 31st to help keep patients safe. To determine what test a patient is going to get, when they call into the facility, they will speak to a nurse or another member of the medical team to determine what tests we determine to perform in the car. We discuss that with the providers, and they deem what is necessary based on your symptoms. It may be strep testing and COVID-19 testing, strep, influenza, and COVID-19 testing, or just COVID-19 testing, but we utilize our medical team to determine what tests we are going to do. Then those are performed in the car. The second question, why did we decide to make these changes? I think that's a great question. We wanted to make sure that people were understanding that COVID-19 is a complex virus, and we're dealing with it every day. However, there are other illnesses that are out there, and what we were starting to see in our clinic was individuals were being seen for COVID-19 only and just addressing that symptom and then following up later if that was a negative test. If that's possible, then some of these other diagnoses such as strep or influenza can go on for another couple days, and that could lead to a lot more emergent situations. So in discussion with our medical providers and our team, we determined we want to address these right away. We want to be there for the community and the patients. So we opted to make our changes to address medical needs as they show up that day and provide any care we need to, so any conditions that could be treated at time would be done in a timely manner.
Yes, they are climbing. It's kind of seeing that 9 day to 2 week, delay after activity certainly increased in this town. We don't have significant concerns about PPE right now. We've secured that. It's going to be safe for our staff and safe for people coming in. Space is an interesting one. We have adequate space. We have we're licensed for like 640 beds. We are opening up a 17-bed unit on the Bryan East campus that is nearly completed being remodeled. There's been a number of units opened up at West, and we have some flexibility there. I think honestly the biggest challenge that is facing this part of the world, and probably more globally than that, is the availability of healthcare workers. There's been a nursing shortage that has been talked about for years and years, and it is tight, not just for Bryan, but everybody in the state. You might be able to increase your facility capacity, but getting the workers or the employees in place to staff those is a challenge. And I feel for our friends at CHI. I feel for our clinical folks here. They have been running full speed since late February, early March on this. So that people, we're watching the kind of the status of our staff and so forth, as I know all our organizations are. But to get back to your question, PPE is not a huge concern for us. Space, we manage that all the time. Every day we look at how many surgeries are happening, how many are going to require an overnight bed, how many casts are happening, how many will require an overnight bed, or which of them are same-day surgeries. And the bed board and the management of that is a daily thing we work with, and we're doing all right. But yes, there are a lot of ill patients in here, COVID related. And again, overnight we had 507 patients total, and 42 of them are COVID. So skyrocketing, significant, steady climb, however you want to categorize it. We're seeing that in our community right now. We have what we call, this is a big thick document, but we have what we call a surge plan. After our learnings of the first couple of months of COVID, we kind of recentered ourselves and said, okay, in the summer months when it died down, anticipating flu and another surge coming of COVID, what are the things that are in place for these type of things? And we're not at that point right now. I can't speak specifically to if there's identifiable triggers that would cause some of that. It would certainly be a group decision with all healthcare providers in the city, Department of Health, and so on to get to that point. So probably not as direct as you're looking for, but it's the best I can do, and just want to reassure people we have a surge plan in place that has been established to monitor all of these things.